in NHS Digital in England, we started a beta process for an assessment type framework so that we can look for apps that already exist on app stores, such as Google Play and the Apple App Store, to find apps that meet a need from a healthcare perspective, and then assess those apps so that we can see if they are suitable for use in the NHS. So we take them through an assessment process, and once they complete that process, then we showcase them on an apps library, an NHS apps library.
Yeah, and how does these assessments look like?
So the assessments, they cover 9 key areas. So we look at things like clinical indicators of effectiveness. So does the app that you're suggesting, does it actually lead to positive outcomes? We look at things like clinical safety. So does the developer understand their obligations as clinical safety officers? Do they have hazard logs, safety logs? Do they have the right processes and procedures in place if there is any adverse reaction? And we look at things like data privacy. So we've just updated the assessment to include the GDPR regulations. So we'll be taking the apps through that assessment. And then we cover things like usability, technical stability, interoperability. It's about, for an app with all kind of functionality and that's we profile as quite a higher risk app, that can involve around 210 questions. And then for the lower scale apps that aren't integrated and that don't capture data, it can be quite a simple process. But what we tend to find is that most apps don't pass first time. There needs to be remediation activity to get it to the required level. So I guess from our part, that proves it's working, that we're getting apps to a higher quality level. But yes, that's the assessment process.
And what kind of apps are we talking about?
So we talk about a range of apps. So things like Brush DJ, which plays 2 minutes worth of music so that a child knows to brush their teeth for 2 minutes. And then we've got apps that enable digital transactions online, so ordering repeat prescriptions, medication reminders, booking appointments with the doctor online, and managing their appointments online. And then we've got the more clinically based apps, so apps for mental health, apps for specific users such as pregnant ladies with diabetes. We've got healthy living apps, so focused more on fitness and improving well-being and eating the right foods. So we've got a whole range of apps.
And these assessments you do with these apps, is it different from assessing, say, a new X-ray machine or other types of technologies in hospitals?
Yeah, so it's an interesting one. So I think for those kind of machines, the regulation has kind of been defined and standards had already been defined. So I think for us, what we had to do is, because this is, technology has kind of overtaken regulation in this digital environment. And I know Facebook have been in the news recently because I think there's more of a call for regulation and legislation for things that weren't considered previously. And for us, we're having to think through the things that regulation doesn't yet exist for and satisfy ourselves by asking our own questions. So although we've based our assessment as much on existing regulation and legislation, there are some additional questions that we as the NHS ask for evidence of to satisfy ourselves that it meets the right quality. So that's one intricacy. And I suppose the other thing is the difference with apps versus other technology is that the kind of lifespan of apps tends to be shorter than kind of core traditional technologies. So whereas you may procure systems that you expect to last you 5, 10, 15, 20 years, I think with apps, the lifespan tends to be much shorter. So we need to be able to assess them at a much quicker rate than I think would be acceptable for the much more heavyweight systems.
And we're obviously here in Gothenburg at Vitalis in Sweden. Do you have any collaboration with Sweden?
We do, yes. So we work quite closely with Sweden now. So we were lucky to host a delegation of 22 health and social care colleagues from Sweden a few months ago, who were embarking on this journey already. So because we're already a year down the line, it's a great opportunity for us to share our learnings and kind of signal the things to watch out for and signal the things that you might want to give more attention to and kind of just share the learnings that we've managed to build over the last year of the beta. And we've also had interest from Denmark and Japan, Australia, Ireland, Scotland. So I think we'll be working with our colleagues here in Sweden to maybe broaden our collaboration efforts so that we can bring those into the fold and see how we can all learn from, but also continuously improve the approach for all of us, really, so we can all benefit.
Yeah, and how do you see that work going forward? What would be the most important points for you at the NHS in the UK, but also in a bigger collaboration point of view?
Well, I think from our perspective, this is a global level piece in the sense that apps that are surfaced within the app stores tend to be global apps anyway. So it makes sense that we would probably, as we're all working in the same sector, that we would have the same challenges and European legislation, we share that in common. So to me it makes sense that we kind of share learnings from across the water in all sides to understand, well, what are your learnings, what have been the blockers or what have been the great things that you've tweaked and changed, and how can we benefit also from that? So I think I see it as an ongoing kind of relationship built on continuous improvement. So even though we've developed this beta process, our style back in England is lean development. So we don't lock ourselves away and wait until we've built something and then release the whole thing as one big bang. We work on lean development technologies and continuous improvement. So I think it's a perfect time for us to get together, and also any legislative and regulatory changes that we need, we're also going to have those in common. So it would make sense to address those at a European and potentially global level anyway. So I think it's going to be, going forward, it's going to take the basis of what we've got and hopefully make it something really world class.
Hazel Jones, thank you very much for your time.
No, thank you.